At the end of this lecture, you should know the definition of a healthy newborn. What are antenatal and postnatal periods? The nutritional requirements of a newborn baby, and complications that a newborn may face. Term gestation is when a baby is born in between 37 to 42 weeks gestation. A healthy newborn should have appropriate weight and height. The head circumference of a term newborn baby typically ranges from 33 to 37 centimeters. A healthy newborn will not have any associated congenital anomalies. Why is newborn examination important? Newborn examination allows early detection and prompt treatment of any abnormalities encountered. The examiner will need to be able to distinguish between what is normal and what is not. Knowing the full antenatal and maternal obstetrics and gynecological history is important. This includes obtaining the mother's complete medical history and regular antenatal checkup findings. It is also important to obtain record of any supplements taken during pregnancy, including folic acid and iron. We also need to ask if the mother took certain medications such as anti-epileptic drug, which can potentially cause congenital anomalies. Essential postnatal period information includes the mode of delivery such as spontaneous vaginal delivery, assisted delivery or lower segment cesarean section. We should also find out the APGAR score of the baby. It is a scoring system which summarizes the baby's condition post-delivery. Newborn examination is a complete head-to-toe physical examination which is performed on every baby. It is important that the examiner is able to recognize both normal and abnormal findings. It is a screening method to detect any congenital infections or anomalies which may not be picked up antenatally. The findings helps guide appropriate management. The components of a thorough head-to-toe physical examination soon after birth of a baby include a systematic examination of the skin, limbs, abdomen, chest, face, and head. The red reflex should always be elicited for detection of congenital cataract. Knowing the full antenatal and maternal obstetrics and gynecological history is important. This includes obtaining the mother's complete medical history and regular antenatal checkup findings. It is also important to obtain record of any supplements taken during pregnancy, including folic acid and iron. Jaundice, or yellow discoloration of the sclera and skin, is very common in neonates. It occurs as a result of hyperbilirubinemia, which can be physiological or pathological. The onset of jaundice, as well as the bilirubin level, provide clues to the cause. Another essential component of newborn examination is examination of the hips. The maneuver is called Ortolani and Barlow. It is a form of screening for congenital dysplasia of the hips. Please click the link to view on how to perform Ortolani and Barlow test. Examination of the tone includes checking for limb position, ventral suspension, and head lag. Neonatal reflexes that are elicited include the sucking reflex, Moro reflex, and Palmar grasp. Why is newborn examination important? Newborn examination allows early detection and prompt treatment of any abnormalities encountered. The examiner will need to be able to distinguish between what is normal and what is not. In Malaysia, several screening are conducted in the newborn period. These include hearing test as well as cord blood for thyroid-stimulating hormone and glucose 6-phosphate dehydrogenase. Apart from screening and detection of abnormalities, the first day of life is an excellent time to provide early protection to newborn by vaccination. T. He vaccinations given at birth in our country are BCG and hepatitis B. The red reflex should always be elicited for detection of congenital cataract. This table shows the carbohydrate, fat, protein, casein and calories content of different types of milk. The amount of minerals such as sodium, potassium, calcium, phosphate, and iron also vary in different types of feed. The nutritional requirements for babies up to 6 months of age and babies between 6 to 12 months vary. As a guide, a baby should be able to fulfill the requirements if being fed 150 ml of milk or formula, per kg per day. While breastfeeding is the best feed that we can offer to babies, it has several contraindications. These include maternal HIV infection, galactosemia and fatty acid oxidation defects. Complementary feeding is introduced when breast milk or formula is no longer enough to meet the nutritional needs of the infant. This is called weaning and typically covers the period between 6 to 24 months. Examples of complementary food include pureed vegetables, mashed fruits, porridge, soup, and others. Newborn assessment begins with a thorough antenatal and postnatal history. This is followed by a head-to-toe examination of the newborn, and distinguishing normal from not. Baby's growth is influenced by good nutrition and breastfeeding is the best at providing it. Early protection by vaccinating against BCG and hepatitis B can also be given.